So during the last few months, while the COVID-19 pandemic was spreading over the entire world, we've started to see lots of press articles showing the temptation for authorities to deploy global geolocation tracking systems in order to fight against the pandemic. We feel very concerned about these systems threaten the privacy of individuals and would open the door for excessive usage or exploitation of this massive private data collection. Our contribution to Stop COVID-19 Hackathon is a technical proposal and a prototype for a solution that would give the expected benefit of a global geolocation tracking system, but preserving as much as possible the individual privacy. We called it PLOT, standing for Private Location Tracking. The general application concept is as follows. An app on a smartphone is in charge of collecting location of people in real time. Say one day an individual is made aware of his infection by the disease. We may suspect this person being infectious for people he has contact with in the past days. So we ask him to publish his location record for the last 15 days into a global database. As a result, the global database is an aggregation of locations of infected people over time. Hence, it allows anyone to check if he was at the same location at the same time than an infected person. It results in an evaluation of the risk for him to have been infected in the last days. In case this risk is significant, this person would limit its social contact to reduce the risk of transmission as soon as possible, and he will take appropriate measures to preserve its own health. But there is a problem. Without any precaution, such a system would publicly reveal the personal locations of infected individuals over time. Anonymizing the record, it's not satisfying because it would still be easy to identify people using correlation with their home addresses or workplaces. However, if such a system is centrally controlled, it would mean that the authorities are now able and allowed to track people, and this is a serious threat against the freedom of movement, one of the key human rights. Hence, the PLOT system implements a sequence of privacy guards to maximize the protection of the personal data and prevent from any drift toward totalitarian trends. The first privacy guard we implement is the location filter. The app is designed to keep location record locally only until the user decided to publish it when he's diagnosed infected. But in addition, he can consult the record and choose to remove some explicit locations from the record before the publication. For instance, the home location can be filtered out from the record in order to prevent anyone to identify the infected individual by checking the infection status of his personal address. The second guard, the data is irreversibly encrypted before publication. The idea is to encrypt the location information about where the user was and at which time using an encryption key, but we destroy the decryption key because we don't need to decrypt the information. So anybody can decrypt the information. This guard prevents from any unexpected exploitation in case of data leaks from the global database. It even allows to publish the data on a public ledger, eventually decentralized. The third guard we've implemented is called Bloom filtering. The encrypted location data are hashed by different hash functions, and the results are mapped across a table of n bits. This data structure is known for being efficient in looking whether an element is present in a set. Using this table, it's possible to ask, given a location and a time, whether there was someone infected at the same place at the same time. When encoded into a Bloom filter, it's not possible to get back to the initial data from the result mapping. And the fourth and the last guard is data merging. Data merging means that the global database that is publicly available doesn't keep information per user, but only keeps the aggregated results. So if it's still possible to know whether there was someone infected at some location at some time, it's not possible to know who. This again prevents from unexpected exploitation of data. Now let's see how the check use case works. Given a user that doesn't know whether he's infected or not, using the application, he can launch a check. The check locally creates the Bloom filter structures from his individual location record. Then it downloads the global infection record that is publicly available and compute a comparison to detect how many people, how many potential contacts the user have had in the last days with infectious people. The resulting number gives an idea of the risk the user has to have been infected in the near past days. Now let's see a quick overview of the application architecture. We define 3 parts: the smartphone application, a centralized server, and a decentralized storage area. The smartphone application is in charge of most of the treatment in a way that the individual data stay on his device as much as possible. The data only left the device in the shape of a Bloom filter after applying all the privacy guards we have presented before. The centralized server is in charge of merging the individual data into the global record. Then he's publishing or updating the global record on a decentralized storage service so that it's made available publicly for other users that would need to check the infection status. So the demo is not ready yet, I'm sorry, but here is what we would like to show running on the submission deadline. The first use case is location filtering. The second use case is publishing location record, and the third one is checking the infection status. What are the outcomes of our project? First, we have deliberately chosen to orient our proposal in such a way that we maximize the privacy protection. That means the features are limited to what is absolutely required and doesn't threaten individuals' privacy. The second outcome is regarding the decentralization of the solution. We attempted to implement a complete decentralized solution, but we have faced some issues that would lead us to include a centralized service in this architecture. That's because the data merging supposes that someone is in charge of aggregating data from the individual user. But if we are using a smart contract on blockchain, then each transmission of the individual personal record becomes public. So aggregating the data is useless, and every individual data would remain visible. As an alternative, we would be considered using a secret contract on the Enigma platform to keep this transaction private.
I think we'll probably have to wrap up in just a minute, okay?
Yeah. Okay. To conclude, here are some further development ideas. One remaining vulnerabilities we have identified in our system is how to prevent malicious people to publish their location record without being diagnosed as infected. This would lead to saturate the global infection record with false infected zones and would drastically cut down the system's efficiency. A possible solution would involve trusted actors, doctors, hospital nurses, to authorize an individual to publish his record. And finally, an improvement we have identified would be to incentivize people to check their infection risk periodically, every day, in order to raise alert and trigger protective measures as soon as possible. Such incentives could be achieved by a gamification process. Each day the user submits a check, he's qualifying for a lottery or something similar. The prize could be provided by public or private partners. Think about marketing campaigns. And of course, the prize could also be digital non-fungible tokens like Gitcoin Kudos, for instance. Thank you for your attention, and please ask if you have any question.
Awesome. Thanks a lot, Ludo.
You're welcome.
I think maybe time for.
Hey, Ludo. Sorry, this is Tegan, and I finally figured out how to unmute myself over here. Multiple buttons, challenging. I think this is very thorough in terms of the technology and the workflow and sort of the data management. You got into it a little bit just before you wrapped there in terms of incentivization, but I guess my question or thing to think about is, you know, there's a lot of apps and offerings that are starting to circle around this idea. How do you sort of incentivize users to achieve a certain level of adoption that's needed for this to be valuable in a public health sort of perspective? And also, how do you differentiate yourself from some of the other apps that are out there, or what Google and Apple are working on, which is a little more native?
Yeah, sure. Yeah, I started my analysis to see what are the other applications existing, and I've seen one of the applications that preserve the individual privacy the most are using a Bluetooth connection between smartphone, and it's quite a good solution regarding the privacy preserving. The problem is, yeah, you need people to use this application, and you need people to activate Bluetooth 100% of times. That's what's not the case for everyone. So I was looking for a solution based on the in a way that it would be possible to use existing records. Okay, I'm developing an application that is doing geo-tracking, but of course, geo-tracking is already available in Google services. Maybe the mobile operators can also provide my location for the last 15 days. So I don't need the application. I need a good solution for preserving my privacy, assuming that I have my location records for the last 15 days. So it's the reason why I was looking for how to encrypt or encode sufficiently the data to preserve my privacy before it's uploading in the global database. And what I found, I found some of the solution in other application, but not the complete assembling of grots.